COVID-19 is one of the most devastating diseases the world has suffered, and it is in the interest of people that this deadly disease comes to an end. Ministry of Health confirmation about the reduction of COVID-19 positive cases is one of those relieving statements as people yearn to resume a normal life.
A consistent reduction in daily confirmed cases from the peak of 1,735 on the 10th of July 2021 to a new low of 62 on the 15th of August 2021. 2, a consistent drop in positivity rate from the highest of 22% to an average of 2.8% to date. 3, a fall in the daily admissions of the severe and critically ill patients from a peak of 204 to less than 50 per day to date. 4, a reduction in the daily deaths.
However, in spite of the good news of the reduction in COVID-19 infections and deaths, the Ministry of Health still warns of a looming third wave that is anticipated to be more lethal.
Projections from our scientists show that the third wave of the pandemic is likely to peak at 4,000 laboratory confirmed cases per day. This is over 2 times higher than the second wave. This means that 15% of the patients will require admission at the health facility, and about 9,331 patients may require high dependency units or intensive care unit admissions.
Meanwhile, travel guidelines have also been reviewed and there is no longer categorization of countries. The new measure is that all travelers, including children, will be subjected to PCR COVID-19 tests at all points of entry.
Any traveler, national or non-national, who tests positive for COVID-19 will be evacuated by the Ministry of Health to a designated COVID-19 isolation facility. C, children under 18 years who test positive for COVID-19 will be allowed to undergo home quarantine with their parent or guardian. The basis of this is to ensure that we limit the spread of variants and avoid importation of new variants into the country.
Government is, however, striving to ensure that more COVID-19 vaccines are acquired to vaccinate eligible population.
18 million doses of the Sinopharm vaccine for 9 million people expected to arrive in phases beginning October 2021. 2, 9 million doses of the Johnson & Johnson vaccine from the African Union to cater for 9 million people. This is expected to begin arriving in the country next month, September 2021. 3, the COVAX facility has committed to provide donations of up to 18 million doses to cover 9 million people. These developments align our pipeline expectations to cover the 22 million target population plus the additional population of children.
I think our position is the same as that that the WHO has taken, requesting the developed countries to hold on this decision to undertake third boosters so as to make vaccines available for the other part of the world. And this is largely because we will not be able to effectively control the COVID pandemic unless we vaccinate everybody globally.
Currently, there are 471 COVID-19 patients admitted in different health facilities, with a few others on home care across the country. Adia Nakote, UBC.
Now? A second, doctor.